Hey, everybody. Welcome to Meddkit's Provider Spotlight, where every week we come on here and tell the stories of amazing private practices and physicians from all over the United States. Every week we have someone new, a new perspective, a new story, a new specialty. So we have a lot going on. And today we have a really awesome special guest. I really want to introduce you guys to Dr. Joseph Munsell, co-owner and partner of Cheyenne Vision Clinic and Laramie Vision Clinic in Wyoming. Thanks so much for joining us.
Thank you, Rachel. It's my pleasure to be here.
Yeah, super excited to kind of dive in and, kind of how I start these off is and I think what is kind of interesting to everyone, they want to know like the wizard behind, the door and all that stuff. So people love
Right.
hearing the origin story. People love hearing how you got to be you. What got you to, be an optometrist, help start all these practices. So would love to hear from you on that.
Yeah. So, kind of cliche on my end. So, I just grew to have a great respect for optometry just
Mhm.
because when I was younger, and I still am technically, I'm extremely nearsighted. So, when you're nearsighted, you see better up close and in the distance. My prescription is quite high, and the difference between the eyes is quite drastic. So, because of those things, I can't wear glasses because glasses cause different images for my brain, and my brain cannot reconcile it to a single image. So I was constantly seeing double vision when I was a kid with glasses. And so I had to go into contact lenses when I was, I think, 4 years old, which was quite a challenge. And thankfully, I had a really good provider, and my mother helped me out, obviously, too. But I was in my provider's office constantly for, 10 years probably. And so I just developed a very good appreciation, a very good relationship with my eye doctor. And it changed my life because it took me from not being able to function on a day-to-day basis to being able to live a normal life. And
Yeah.
because of that, I essentially wanted to be able to provide that for other kids, for other people, and just to help them optimize their life the best they can.
Yeah, it seems like, even as a kid, you wanted to like figure it out. You're like, I'm tired of this and I want to make this work. And that's really nice that you had someone to look up to and also take you on your own personal journey that, really helped you out. So I love that. That's
Yeah.
terrific. How would you say, are the most, what would for you be like the most common areas that you find people are struggling with right now? What common areas? I mean, we probably might know some of the basics, but nothing is, provider spotlight, anything goes. So you might tell me something we really don't know.
Yeah, so I think with eyes in general, just with the change, especially since COVID, everything is going to more of a screen base like this. Um, our eyes are just getting fatigued much more quickly during the day, which can lead to headaches. Not only in that, but for kids, it has been shown that by introducing these screens to kids in school and at younger ages, we're actually making them and contributing to them becoming more nearsighted, like me. Now, it's a common misconception that nearsightedness is just a glasses issue, right? But essentially, what happens is your eyeball lengthens from front to back. And when that happens, it stretches all of the tissue on the inside of the eye out. And so, the more nearsighted you are, the more likely you're going to have retinal detachments, cataracts, glaucoma, macular degeneration, all these other conditions later in life. And it's becoming a growing need and concern in our community that all of this screen time we're giving to kids nowadays is going to set them up for these potentially sight-threatening conditions later down the road. So that is something that our profession is really tackling head on. And we've come up with some great new therapies, great new technologies to slow down this
Yeah.
progression in kids' eyes. So whether it's with an eye drop that we take at night, specialty contact lenses that are essentially like temporarily LASIK treatments for kids. We're doing all of these things to slow down the progression and the lengthening of the eyeball to try to stop these conditions. So I would say that's probably one of the number one concerns our profession is facing nowadays. Just because, like I said, the dynamics in schools and just the way we communicate with each other has changed.
That is so crazy. See, everyone, I always ask that question because everyone has a different answer, but also I had no idea that that was such an issue that your field was facing right now. I mean, it makes sense, given what we've all been through with COVID, and I'm sure that progressed a couple of things. You know, just everything is online, but I had no idea that that was changing our health, our vision, and that is very, very good to know. And I'm sure a lot of maybe new parents would uh, be thinking about how much screen time their kids are having now. Yeah,
Absolutely. And that's why I always recommend even if you think your child sees okay, bring them in for an eye exam because once again, kids don't know what they don't know and they don't know what they can't see. So even
yeah.
if you think they're functioning well, just getting an eye exam around age 2 to 3 is always a very smart thing to do.
That's awesome. Super duper smart. Um, in terms of your approach, I'd love to hear, and you talked about this in the other question, just ever so slightly, but how is your approach different? And then are there other technologies or procedures, maybe you have some specific situations that, you might be able to tell us about?
Yeah, so I mean, our approach to patient care is, we want to provide as much value as we possibly can to the patient in our chair. Even our core value of our organization is be our guest, and so that means that every single, we're taking that from Disney, right? But
Yeah.
we we approach everything we do in our clinics is based through that lens that we want to make people feel like a guest in our house when they come into our clinic. So we want to make sure they feel comfortable, that they're taken care of, that they feel, loved essentially. And so that's how we approach all of these things. And that has changed the way that we provide our services, the hours we're open, everything is filtered through that lens. Now, as far as new technologies, same thing. We're lucky. We have a 2 location, 10 doctor practice. So we're able to offer what we call full scope optometry. And so we're
Mhm.
able to do dry eye treatments, specialty lenses, laser surgeries. We take call and emergency cases from the ER, so taking metal out of the eye. So we're able to essentially anything related to the eyes or visual processing, we're able to do here. And we think that's key to keep kind of everything in house. So somebody just has a one-stop shop, if you will, for everything eye related.
That is awesome. And that also is probably so much easier for you guys to oversee all that because the information being exchanged with the patient, it's like, your doctors, you know what they're recommending. It's easy to communicate with one another on the back end about that particular patient and following up with them. So it's a very like holistic way to treat someone. Yeah.
Exactly. I mean, these patients have seen us a lot of times generations of their family members, and they trust us. And it's just we think it's better care to try to keep them here as much as we can.
Yeah, no, that makes a ton of sense and very cool because that range and scope is so different
Yeah.
from what you described. So that's very neat that you guys can be able to handle that kind of caseload and peculiar cases, maybe, run of the mill, got some, general eye things going on, but that's really neat. What would you say, and you touched on this a little bit earlier, but with the age of Google and everyone's chat GPTing everything to get their immediate answers,
Yeah.
I always say Dr. Google versus the real doctor, what do you feel like you're constantly debunking all the time? Are people just coming in with outlandish questions, or maybe they're very common questions that you're debunking all the time and it's the same thing over and over again? What are those for you in your profession?
Yeah, so there's a couple ones right off the top of my head. One would be, if I get a pair of glasses, is that going to make me dependent on the glasses? Or if I start wearing glasses, is it going to make my vision worse? Very common concern, and I understand it, but not true at all. It's more of that when these patients that haven't seen well for a while finally get a pair of glasses and then they see so well that when they take them off, it's more of an awareness of just how bad they were seeing prior to now
Sure.
that they can see clearly. So that's a common myth that we get. Another one, once again, is I see clearly, I see fine, so why should I have an eye exam? And once again, an eye exam is much more comprehensive than just finding a glasses or contact lens prescription. Like I said, we're looking at the retina, which, the same blood vessels that feed the retina feed the brain. And so we're able to see many different conditions. We're able to diagnose diabetes,
Wow.
certain signs of multiple sclerosis show up in the eye first. So there's many different things that you can see just from a normal eye exam that a lot of people wouldn't necessarily assume. So I'd say those are a few big ones.
That is awesome. Did you say that last one just for me? I mean, that's a me thing.
Oh,
I'm guilty. This is why I'm totally loving this.
yeah.
I have apparently I am 2020, but who knows now? So that's a good debunker for me. I
Yeah.
outed myself on the interview. It's fine. That is really cool. Do you have, I mean, out of curiosity, any other ones that you find that people are constantly reading about? Or Googling or any, whether it has to do with, you said you do some common surgeries or, other types of treatments. Is there anything related to those that you hear a lot?
Like for mitts.
Mm-hmm.
Um, one actually is blue light blockers. And so, it's been heavily portrayed that what's causing fatigue and making eyes worse for the screens is actually the blue light coming off of it. Now, I'm not fully dismissing that. I'm not saying that's not true. There is a component to blue light, I think that does lead to fatigue and eye strain.
Mm-hmm.
But more of that has to do, as far as the fatigue part, it has to do with just because you're looking up close for so long. When you
Sure.
look up close, you have to flex a muscle on the inside of the eye. So essentially, every time you're looking close up, it's like holding a dumbbell. So eventually, your
Mm.
arm's going to get tired. It's going to get fatigued, right? It's going to get weaker. It's the same thing with the eyes when you're looking up close, that you're constantly flexing that muscle. So it's just going to break down a little bit towards the end of the day. It's going to get tired. It's going to get fatigued. You're going to get headaches. And so the computer thing is more of finding a pair of computer glasses to relax that demand on the eye muscle to
Mm-hmm.
alleviate the fatigue rather than the blue light coming off of it. So even
Interesting.
though there is some truth to the blue light causing fatigue, I think it's much less than what people think. So that is also a very common one that gets brought up.
Yeah, those are sneaky little misconceptions. People, if you go to an eyeglass shop and, you have your prescription and you're trying things on, they might try to tell you things or, oh, get the blue light blocker, which might be a good thing, but that may not actually be the total cause of your fatigue. So, very,
Exactly.
very interesting. This is kind of a two-prong question, and I like asking this one just because of your background and how you became a partner and opening up these two amazing clinics, but also what other normal people like patients should receive in advice. So it's a two-prong advice question is, what would you give to someone out there, patient of yours, or something out there that, hey, this would better your eye health if you started doing this today. But also the other prong question is what other kind of pro tip would you give to, because of the nature of what we do and helping private practices, you know, what kind of pro tip would you give to another private practice that is trying to up their game or something that you have found that has been really important to you in your practice that you'd like to share with others?
Yeah, so to answer the first part about what advice is kind of preventative measurements for patients, one is take your health serious. I think in any profession, any health profession you get into, I think regular exercise and proper nutrition is probably the most important thing. That
Yeah.
definitely goes with your eyes as well. Try not to eat extremely processed foods, and then, like I said, having a exercise regimen is great. As far as the eyes go, taking an omega-3 supplement or eating a diet that's very rich in omega-3 fatty acids is extremely important for tear production and just overall anti-inflammatory effects for the eyes. Very important. And then, we've been talking about screens a lot today, giving yourself a break from screens. So if you're on it for more than, 20 minutes, take a quick 1 to 2 minute break, let those eyes relax a bit, I think would be extremely important. On your second part of the question on kind of what advice would I give to people looking to open a clinic or people that just opened a health clinic, there's a couple different ones there. One I think is huge is having a great network around you and finding really good mentors.
Yeah.
I know for myself, I wouldn't be anywhere professionally if it wasn't for my mentors and the people that came before me. And one thing I like about my profession, and I think it's similar in a lot of different professions, are the people that came before us, they're very willing to help that next generation out. And so whether that's business, I mean, I have a couple of really good partners here that help me with business decisions and kind of brought me along there. Then on the clinical side, my old professors, I reach out all the time to them to get new advice. And it's just surrounding yourself with people that know more than you, I think is extremely, extremely important. As well as, figuring out what your competitive advantage is going to be for your clinic. And that can be many different ways. Are you offering more technologies, the latest technologies for patients? Are you offering more convenient appointment times? Meaning, are you open late a couple of days? Are you open early a couple of days to allow those people that work, parents that have children in schools that can't get off and take school off during the day, or even a Saturday appointment? Just allowing people more opportunities to find you and more opportunities for these services. And that's something that we have done, and it's been incredibly successful. And so just things like that, as well as starting off, I think having your dream clinic in your mind, having a vision for what you want your clinic to eventually be before you start, I think is probably one of the more important things, because once you know that, all the other day-to-day decisions are always going to be filtered through that lens, through that paradigm. It's just going to make the decision-making process much easier when everything that you're doing is aligned towards that end goal. So just a few things there.
No, I love it. I mean, I think one for patients, great advice. I feel like people don't talk about nutrition more. They really need to. It's something that affects every part of us. So I love that you mentioned that. I know maybe some people don't correlate omega-3s or just having great nutrition and not eating processed food with your eyes, but we're all connected, right? It all makes sense. So I think that's important, but as well as, some of the things that you mentioned, pro tips for other practitioners, I think it's really smart to always, keep learning, also be humble, take advice from others and surround yourself in a great network. So couldn't agree with it more.
Yep.
Love the pro tips. But before we leave off today, I would love for you to tell folks where they can touch base with you, where they might either be able to reach out for some clinical advice, for some, maybe they're trying to, build their community as you had talked about, and would love to touch base. How would they do that?
Yeah, so you can reach me. Probably the best way is my email, which is just jmunsell@cheyennevisionclinic.com. One of the easiest ways. Um, if you want to follow with some of my things, I write for industry newspapers, so review of myopia management, review of optometric business, and a few other ones is a good way to stay in touch too. And once
Nice.
again, like I said, talking about the network, I mean, I have mentors that are in completely unrelated fields, and there's a lot of things you can take from other industries, from other people in those other areas, and then take it towards your business just to level up and get to that next station. So I think that's huge as well.
Awesome. Well, it was so great having you. I hope to have you again. You are a wealth of knowledge and just appreciate your time.
Thank you so much. It was a pleasure being here.
Thanks.